My name is Joe Koudelka. I have a doctorate in physical therapy, and I'm the owner of TBRX Franklin. So I worked as a body coach at a nationally recognized performance and recovery center. It was an amazing experience to be able to work with athletes at the highest of levels on professional teams. And because of this particular center's reputation, we saw so much clientele that we're not the high-level athlete. These are the top questions asked by patients about rotator cuff injuries. What is the typical recovery timeline for a rotator cuff surgery? The typical recovery timeline will first start with, when it comes to returning to your sport or activity, is about 5 to 7 months. The first 12 weeks, we should see a full return of range of motion. So that, as an example, that's a client or a patient being able to lift their arm up overhead. After that is when we can begin to push strengthening. We want to strengthen that rotator cuff muscle and the surrounding muscles. So an athlete or client is ready to return to sport or activity, again, around 5 to 7 months. What are the do's and don'ts during my recovery period? During the recovery period, the things we definitely want to do are hydrating well, getting plenty of rest. You want to follow the guidelines given to you by your physical therapist and your orthopedic surgeon. Typically, in the short term, you're going to be in a sling, immobilized. We really want to make sure we adhere to that because you're protecting the surgical site. The things we don't want to do following surgery would be pushing your range of motion through pain, pushing your range of motion too early, and we don't want to push strengthening too early if we don't have full range of motion. Will I need physical therapy, and what will it involve? All patients will need physical therapy after surgery. And the reason why is it's a very methodical rehab process. The early phases of physical therapy, you're going to want a licensed physical therapist, someone who's a professional and trained in proper movement mechanics, to take you through a sequence of gaining range of motion back, gaining function in that shoulder, and then strengthening the shoulder. We don't want to do those things out of sequence because it can create more stiffness and pain in the future in your shoulder. So typically, a physical therapist will guide a patient or an athlete through manual therapy on the muscles to improve muscle activation. They're going to guide them through some stretching to improve joint range of motion at the right time, and then specific strengthening exercises for that patient or client to get them back to their sport or activity they want to return to. Is physical therapy necessary if I'm not feeling pain after surgery? If a patient feels fine a few months out after surgery and they're questioning whether physical therapy is necessary, I still would recommend that they get an evaluation or follow up with a physical therapist if they had been doing that early on. Physical therapists are trained in proper movement and helping restore proper posture and balance to muscles. So as much as someone may be feeling asymptomatic and pain-free, that doesn't always mean that their shoulder is moving properly. How can I manage pain and inflammation during my recovery? Pain and inflammation can be managed with things as simply as ice or heat. Ice is often best immediately following surgery. Weeks later into your recovery process, if you're still dealing with some pain in the evening or just general soreness, heat can be helpful also. Anti-inflammatories can be considered too, just under the guidance of your sports medicine physician. When can I return to my regular activities or sports? You can return to your regular activities or sports around the 5 to 7 month mark. Again, physical therapy, there's going to be a sequence in your rehab process where we're looking to, in a sense, check boxes to make sure range of motion is there, strength is adequate, and that you can do your sport-specific movements. How can I prevent future rotator cuff injuries? So if you're an athlete, and especially an overhead athlete, a tennis player, if you're playing baseball, again, any overhead throwing sports, you can injure your rotator cuff, whether it's a tear or a strain to that muscle. So here are some things you can do to reduce the injury risk of a rotator cuff tear through multiple factors, actually. Let's hydrate well. Our muscles are about 60 to 80% water. Tissue that is dehydrated, where you're not drinking enough water, that'll stiffen muscles. That can lead to a higher risk of injuring a certain muscle. Another big one, there are links between eating highly inflammatory foods with arthritis in joints. Arthritis can lead to rotator cuff injuries. I recommend that you would consult a nutritionist if you think you need to change your diet to remove some inflammatory foods. And then from the standpoint of remaining active and exercising, first and foremost, you want to improve your tissue pliability. That's improving the muscle activation. That's getting nutrient-rich blood flow and oxygen to those muscles. The way you do that is with foam rolling. Make sure you're doing that prior to exercising your upper body. There are also good exercises to incorporate that activate the rotator cuff muscles and that strengthen what we call your shoulder stabilizing muscles. What are the signs that my recovery is not progressing as expected? Often, patients and clients that I work with like to speed the recovery process along, and they think that their rehab may be progressing too slowly. This recovery requires a lot of patience, and it requires a lot of adherence with what your physical therapist is recommending. Signs that your recovery is not progressing as expected would be if you're getting worsening pain during the rehab process, if you're starting to experience more pain at night when you're trying to sleep, and then lastly, if you're developing a lot of joint stiffness and your range of motion isn't improving but getting worse, that's where you definitely want to consult with your physical therapist or your sports medicine physician. Will I need a surgery if my condition doesn't improve? Often our clients or athletes are not going to need another surgery if their recovery process is going too slow or they don't feel like it's improving. Sometimes it takes a little bit longer time than that 5 to 7 month window. Sometimes we get an athlete or a client who develops what we call frozen shoulder, and that's where the range of motion gets very limited in the shoulder. In those instances, physical therapy is still best. It's just, again, going to take a longer process to get that person fully recovered. How can I adjust my home or workplace to aid in my recovery? There are a few adjustments that can be made to your home or workplace to aid in your recovery. One of them would be to lower any items that you need to reach up overhead for, lower them to a level where they're more easy to grasp. Sometimes getting in and out of the shower can be a challenge early on after surgery. So we recommend patients to set up some sort of handle or grasp where they can hold on to a handle while they're showering. With their non-surgical side, it helps them with balance. If you have the space in your shower, you can also put a chair in there to make it easier for your balance, so you could be seated. In the workplace setting, if you're in an office chair, we recommend our patients to adjust the office chair to a height where the armrest is meeting their forearm. And if they need to put a pillow under there also, so it supports the shoulder better, you can do that as well. And lastly, sleep can be an issue after these surgeries for the first few days. If you have the ability, sleeping on a surface like a recliner is going to be best. What are some practical ways to increase strength and range of motion with a rotator cuff injury? There's an exercise sequence that I've provided for any athletes or clients who are dealing with a rotator cuff injury. They're on their way towards surgery, but it's always important to do some of this work prior to surgery. The more strength you have, the more range of motion you have in your shoulder, the better the outcome after surgery. As a quick disclaimer, there's a wide range of severity of rotator cuff type tears. And so all of these exercises may not be indicated for you. Certainly if you're dealing with pain in these movements, we don't want you to go into them. But this is a cohesive sequence of what to work on to make sure that you're coming out of surgery with the best strength and range of motion possible. We have pliability-based movements. That's going to consist of foam rolling for the shoulder blade muscles and for the front of the shoulder muscles. Then we move into our mobility exercises. Those are movements that work on posture. Often, if the posture in the mid-back, the thoracic spine as we call it, isn't adequate, it limits overhead range of motion for the rotator cuff and for the shoulder. Then we'll move into strength exercises, and those are broken down into rotator cuff specific strengthening exercises and shoulder blade stability exercises. You've got 17 muscles that attach to the shoulder blade, so we want to make sure that we're strengthening up each piece of it to best support the rotator cuff.